Hi, my name is Ramesh. I'm an orthopaedic surgeon specializing in foot and ankle conditions, and I practice from New Victoria Hospital in Kingston, Parkside Hospital in a field in Wimbledon, and also in central London. Today, I would like to talk about ankle sprains and ligament weakness. Almost everyone would have had injury to their ankle, which is often turning in, or what we call as inversion of the ankle. This leads to either one or two sections of your ligament getting damaged. Quite often, people have pain and swelling for a few days, and this tend to get better with rest, ice, compression, and elevation. The famous acronym for this is RICE, R-I-C-E. What happens if you do not get better within a few days? There may be quite a few possibilities. You might have more than one ligament injury, or you might have damaged some important structures such as the syndesmosis, which is a ligament connecting the two bones. And this may lead to persisting pain or weakness in the ankle. How can we confirm the diagnosis? When you come in to see us, we will have a thorough examination, and often we can make a diagnosis based on clinical tests. But a MRI scan would be much more detailed and tells us everything we need to know about your ankle problem. Sometimes you can have a small chip fracture hiding somewhere in the depth of your ankle. All those things will be revealed in a good MRI scan. We can then focus on treatment, which often starts with a good course of physiotherapy. Physiotherapy is very successful, and many people do not need more than this for recovery. Despite providing you good treatment of exercises and rehabilitation, and sometimes using an ankle brace, some people may have weakness or pain. This affects their sports hobbies, running, sometimes even day-to-day activities, which is not acceptable. If you have continuous, persistent, symptomatic instability, which is ankle giving way even for normal walking, then it is not easy to manage. Some patients may have hypermobility naturally, and these people have very bendy joints, and if you sustain an injury, it makes things much worse. So once we exhausted all the non-operative management, we'll have a discussion if surgery is suitable for your problem. And this often requires anesthetic and a day case surgery, where I will repair two of the ligaments on the outside of your ligament complex, or ankle as we say. And in some patients, I'll be able to use an extra artificial ligament called internal brace, which is very successful in providing early strength and allows you to return to activities much sooner than the traditional way of protecting it for about 6 weeks.